The specific carbohydrate diet, known as SCD in English, is one that Dr. Sebecker uses. Mixing the low FODMAP diet with the specific carbohydrate diet, and she calls it the specific diet for SIBO. According to her, its effectiveness is over 80%, and it seems to be better than the other nutritional plans, but it's much more restrictive. So if you've ever tried or followed the low FODMAP diet and found it restrictive, just imagine one that's even more restrictive. Then there's the Biphasic diet, which I've used a lot from Dr. Nirala Jacobi. The good thing about it is that there are different phases. So the first phase lasts for the first month or the first 3 weeks, and then the second phase starts to incorporate some foods. I find it more comfortable. If my patient does not have a nutritionist or cannot afford one, it is more comfortable for me because he can modify the phases himself. Some professionals suggest antibiotics or probiotics. They recommend it. These restrictive diets reduce microbial diversity, hindering recovery. Fiber helps. But a year on it can cause deficiencies. They say, look at the low FODMAP diet. We have experience with patients on this diet for a year, and as discussed earlier, these diets are so restrictive, wiping out microbial diversity, and then it's tough to recover. Adding fiber helps you bounce back quickly, but a year on a low FODMAP diet can cause micronutrient deficiencies. Then there's the Fast Track diet, created by Dr. Noam Robillard and designed for IBS. It's similar to the others. The Cedars-Sinai diet is attributed to Dr. Pimentel, another SIBO expert. Then there's the Fast Track diet, which was created by Dr. Noam Robillard and was originally designed for irritable bowel syndrome. It's very similar to the previous ones. The Cedars-Sinai diet is attributed to Dr. Pimentel, who is another big name in SIBO. I would say that among the digestive specialists, he's the top professor of all of them and knows the most. Well, he's not a nutritionist, but this diet is also really good and can be used for preventing relapses. The low FODMAP diet was created by these two doctors, Dr. Sue Shepherd and Dr. Gibson from Monash University in Australia. In fact, if you go to the Monash University website, there's quite a bit of literature, a lot of examples, and plenty of material on the low FODMAP diet. And as we've been saying all along, the big problem it has is the deficiency of macronutrients, of polysaccharides. Then there's the specific carbohydrate diet created by Dr. Haas, known as the GAPS diet, which some of you might know because it's primarily designed for autoimmune conditions, by Dr. Campbell. And then there's the paleo diet. The paleo diet is also a good option for both autoimmune conditions and bacterial overgrowths. And the key point is, as I mentioned, to achieve at least a 90% remission of the symptoms.